Upon entering Major League Soccer, Whitecaps FC ownership, management, and coaching staff made a commitment to ensuring that their players had access to the best training and sports medicine care available. We are proud to say that AFX is part of that commitment to excellence. The Whitecaps own multiple AFX and use them every day for injury prevention, injury recovery, and to improve player performance.
My name is Graeme. I'm originally from Richmond, BC, born and raised there. Grew up there, ended up going to UBC, to the Human Kinetics program out there. Actually played soccer for UBC for 3 seasons, and from there went to University of Alberta, where I got my physical therapy degree. Worked in a clinic in Richmond for a few years, and then was fortunate enough to get the opportunity to become the club physical therapist for the Vancouver Whitecaps. And I've been doing that now for the last 3 years. It's great because it gives me a chance to do something I love. Obviously, I grew up playing soccer and love soccer. It's one of my passions. We do use it for prevention as well as rehabilitation. I would say probably about 50-50 right now. We really like the device. Right now, we use it for all kinds of different injuries. Mostly for lateral ankle sprains and lower foot injuries. We've used it for mid-foot sprains, Lisfranc sprains, tib post tendinopathies. I've even used it for plantar fasciitis. I've had guys trying to strengthen their arch, some of the intrinsic muscles of the foot. And then on top of that, once a player has been identified as having a weakness or a laxity in the ankles, right away, we get them on the AFX, doing a strengthening program. And basically, we have an understanding that if you're going to get your ankles taped, then you have to do your exercises. So that's one of the main things that we use it for. We get a bunch of guys doing their preventative AFX exercises daily. The number one reason why I prefer it to other things is you can definitely secure the device to the foot, and it gives you the opportunity to do better exercises, better quality exercises, getting into ranges of motion that are difficult to get into if you have for example, a piece of band that may slide around on your foot or that just isn't secure. One of the main reasons that I like about the AFX is you have the manual control, so you can either adjust the tension that you're going with it, or one of the major benefits is you can add a little bit of eccentric force. And with most of my programs that I give out, I do add in that component where the guys are having to do an eccentric muscle contraction, or some people will call it like a negative, to gain that muscle strength. Players enjoy using it because they can feel the difference, and I think that goes without saying, that it definitely works a muscle a little bit better, and an athlete who's very tuned in with their body, they can tell the difference when they're getting a better result. So the feedback has been great. At first, guys are sort of like, well, what is this thing? What is this contraption, Graeme? I don't know what you have me doing. But as soon as they strap it on, they realize that this is going to help them. They can see the benefit. It doesn't actually take too much convincing from me that this is going to be useful for them in their rehab or in their prevention, whatever we may have screened them up for.